Hey guys, and welcome back to my second episode. I am so excited to be here today. Today, I'm going to share with you about a question I get asked all the time. What toothbrush should we be using at home? For those of you who don't know me, my name is Alex. I am a dental hygienist who specializes in pediatric dentistry. Basically, pediatric dentistry is the branch of dentistry that specializes in children, from infants all the way to adolescents. I'm here today to share hygiene tips with you because parenting's already hard enough. Let's make teeth easy. All right, let's get back to the question about how do we pick a toothbrush? If you're anything like me, picking a toothbrush or choosing anything really can be a pretty overwhelming process. Let's start from the beginning. From birth until the first tooth, we want to use something to keep the gums and the tongue clean because they can get bacteria and plaque too. There are all sorts of options for infant oral care, from the finger brush to an infant toothbrush. These spiffy wipes are also a really great option for keeping the mouth clean and reducing bacteria after feedings. Options for infant oral care can range from very simple to very intricate, and it really doesn't matter what you're using, just as long as you're using it in your daily routine.
Many months later.
Yay! So we have our first tooth. This is the time that I personally recommend we switch to an infant toothbrush. We hand out the Oral-B toothbrushes at our office. They have super soft bristles, and we found them to be very effective. But there's, once again, so many amazing options. I recommend sticking to an infant toothbrush until about the age of 2.5 to 3 years old. After that, we can move on to the next stage. The next stage toothbrush in Oral-B is a 3+. The brush head is still relatively small and always super soft bristles. Ages 8 to 13 can be a challenging time for picking the right toothbrush. Typically around this age, the toothbrush heads seem to be way too big. Or you pick a toothbrush with a character on it and your kids feel way too cool for it. And stay tuned because I definitely plan to post a future video on hygiene with braces because that is a subject within itself. Since I mentioned braces, I do want to touch a little further on that subject. Brushing around brackets can be challenging, and for that reason, I do recommend a smaller toothbrush head than you'd expect. I even hand out an infant toothbrush to some of my braces patients who may be struggling a little bit with their hygiene. This gum toothbrush is also a very effective design because it's got staggered bristles to help brush around the brackets. I definitely plan on posting a future video about electric versus manual toothbrushes, so stay tuned. To recap, we never want to be using anything other than a
super soft bristle toothbrush.
It's going to be pretty challenging to find a medium bristle toothbrush, but don't try to accept that challenge and find one. The reason I'm so adamant on using a super soft bristle toothbrush, and research is there to back it up, is because we don't want anything causing any irreversible damage on our gums and our teeth. The second thing we want to focus on when picking a toothbrush is the small toothbrush head design. When the toothbrush head is too large, we focus on a broad area of teeth when brushing, and that results in a less effective end result. Linked below, I will have some of the toothbrushes I talked about today. Just remember, dentistry is not a one-size-fits-all. Please talk to your dental provider if you have any questions or would like any additional recommendations.
Thumbs up if you like this video.
And don't forget to subscribe and share because sharing is caring.